Hi everyone, welcome back to my channel and you're watching The Brown Feminist. In today's episode, which is episode 2 of this series, I want to talk to you guys a little bit about how to prep for the NCLEX. The first and foremost thing to remember is that you cannot prep for the NCLEX overnight. You can't study for it in a week or even 2 weeks or 3 weeks. You have to give at least a certain amount of time, which can be between 2 months and 6 months of time, depending on how much time you can dedicate each day to study for it. Typically, by the time you're writing the NCLEX-RN nursing licensing exam, a lot of people are already working full-time on a temporary license or in other roles waiting to get their RN license. Which means that if you're already involved in a full-time position, you might not have a lot of time to spare to study at the end of the day. If that's the case, then you'll be primarily studying a little bit on the evenings or mainly on the weekends or whatever days you have off. By that measure, you should dedicate at least 6 months of your time to get really prepared if you want to pass the NCLEX on the first try. Having said that, not everybody passes the NCLEX-RN on the first try, and it is okay to do more than one try. There's lots of amazing nurses I've met on the unit where I work, and many of them have told me they passed on their second or even their third try. So don't be too stressed about, oh my God, what will happen if I don't pass it in the first go? But definitely it is a big commitment of time. It's a 5-hour long exam. You give up a whole day and you pay almost $450 to register for the exam. So if you can, you should try and study hard and prepare well enough that you can potentially do it on the first go. The first thing that I tried to look into when I was looking at how to prep for the NCLEX is, what is the passing mark? Is it 50%, 60%, 80%? How many do I need to get right in order to pass? Sadly, there is not a magic number for the NCLEX, and the marking is a little bit complicated. From what I understood, there's basically not a fixed number of questions that you need to get right or wrong, because when you sit for the exam, you get a combination of easy to hard questions. The more easy questions you pass, the next questions are likely to be the harder questions. And if you get the harder questions wrong, you go back and circulate back to getting easier questions. Once you've answered all of the questions, the ones that really count is how many of the hard ones did you get right. You need to get approximately 50% or more of the hard ones right. However, don't worry so much about this, because in reality, you don't know what's hard for the exam committee. Something that's easy for you might be hard for them, and vice versa. So forget all about how much you have to score and, which ones are the trial questions, which ones are the real questions, which ones are, how many questions you get to answer. Typically, the NCLEX in Canada, the NCLEX-RN as of 2024, will have a minimum of 85 questions and a maximum of 256 or something. And it really depends how many questions the system and this all integrated complex examining system needs you to answer before they figure out that, okay, you've answered more than 50% of the hard questions, or that you have the necessary passing, mark in comparison to their standards. All we need to know is that we need to get through the syllabus, and we need to comfortably be able to answer majority of the questions in our practice tests in order to pass. So let's get into how to prep for the NCLEX. First of all, most people at this point, after 4th year of nursing, even if you're studying for the NCLEX from the next day of graduating, or you're taking some time off for the summer, doing some other stuff and coming back to it in a few months, whatever it may be, it is really important to review your theory. A lot of the theory you may have learned in 2nd, 3rd, or 4th year, and you don't automatically remember it like the back of your hand. In order to review your theory, the best thing to do is to go for a book. And you can go back all the way and study from your original med-surg and physio books, but a really good way to do is to get one of these books, which are, for example, this one is the Saunders book. There's also a Kaplan book. I recommend either of them. You don't necessarily need to do both, but you can if you want to be extra careful. But essentially, these books, which are like the NCLEX exam ones, especially this one, which is Saunders, will summarize in bullet points everything from every chapter of like drugs to physiology to like med surg and everything, and peds and maternity and adult and geriatrics and everything basically you need to know. They will have it in bullet points. So finishing this book is going to be like reviewing 5 or 10 different courses throughout your nursing school. So I do highly recommend doing something like this in the earlier stages of your prep. Maybe the first 1 or 2 months, you can just go through this book really well, make your own notes, your own flashcards, and just keep the things that are really factual that you need to memorize later on. In the second part of your prep, you need to move on to actually doing lots of prep questions. Now, there's a couple of different platforms I recommend. One of them is definitely UWorld, where you can pay a lot of money, like $150 or $200 or something, in order to get access for 30 days or 60 days to get access to their video revisions, their question answers. Some are in study mode and some are in exam mode. In exam mode, you don't get to see the answer right away. You just do all of them and see how much you're scoring, and it can be timed. In the study mode, you just do one at a time. You see whether you got it right or wrong, and it's more so that you can immediately learn and not just test yourself. I like to do a combination of these two. Other than UWorld, even Saunders, the book that I just showed you, they also have their own like URL and online question bank. They have about 5,000 questions. UWorld, to my knowledge, has 10 to 15,000 questions. And honestly speaking, if you can get through all of them, that would be great. Even if you don't, just get into the habit of doing 50 little quiz questions a day. And by the time you're getting to the third phase of your prep, which is the last 1 to 2 months of your prep, in the 6-month prep period, you should be doing at least 100 to 120 questions a day. These are very easy questions. You can sit down for an hour and basically do like 60 questions. That's usually what I do. I get exhausted by doing too many at once, so maybe I'll do like a 50 question or 75 question little test for myself starting off in the morning. Then I go to work, I come back, and when I have some more time, I'll do the study format where I'll be like, oh, this was right, good. I know the confident ones, I'm right. And anything I'm wrong, oh, I can immediately learn and look at the rationale, look at the figure and see, okay, this is something I need to focus on or remember for the next time. Once all that's done, in the week leading up to your exam, you should be only reviewing your flashcards and doing a couple practice tests at a time just to keep your, your mojo flowing or your test-taking mode on. That's basically it. The exam can be anywhere from like an hour or two to up to 5 hours. It can be 85 to 250 questions. You really don't know. When you go in hydrated, take some coffee or juice or water, whatever you need to have with you to survive this exam. Sleep well the last day. I don't recommend any studying. Just relax and just go like, if it happens, it happens. If it's not, my career is not destroyed. There's going to be another chance to take the NCLEX. Having said that, in order to retake the NCLEX after the first failure, you will have to wait at least 45 days. And I have invested so much money in it, so I do hope that I do not need to take it more than once. And that's it for this video today. I hope it has all useful. All of the books and apps and platforms I've mentioned, I will be linking them down below. And I hope that helps you guys a lot. Bye, until next time.